Hi, welcome to Ketobiography. I'm your host, Robin Dobbins. Today's guest is a fighter. She has battled depression, anxiety, schizophrenia, chronic inflammation, obesity, and metabolic syndrome. Then she accidentally transformed her life with low carb, high fat metabolic therapies. After years of heavy psychiatric medication with little relief, she discovered the impact of a therapeutic ketogenic diet, which led to profound improvements in her mental health and physical well being. Her journey from daily struggles to newfound freedom is admirable. Please welcome Harmony Bright to Keto Biography. Hello, Harmony. Welcome. I'm so glad you're here. I have been looking forward to our talk for months now because we kind of went back and forth a little bit on when we could schedule. And so this is our first actual meeting and actual talking to each other. And we've chatted online so many times, but I'm just very excited to chat with you and hear your story straight from the horse's mouth today. So, um, what I
Better
usually
than the other end.
yeah, absolutely. So that's a very good point. So what I usually do is I love to just turn it over. I my whole goal is to not interrupt and to not. I want you to tell your story in your words the way you want people to hear your story. So start from wherever you want to start, and then just keep going. And I'll just take notes and later on ask questions based on what you said. Sound good?
Okay, sounds good. So so basically, I was diagnosed with schizophrenia in 2008. Um, I was a young mother. I had two boys at this time. Um, Prior to that, I would say that my um, cognition was suffering all through middle school, and here I am in my 30s, and I get served this diagnosis. So of course, the only treatment they give you when you're hospitalized involuntarily is medication. That's only the only thing on the table. So for years, I was medicated and I met with a psychiatrist, and I progressively got worse and worse. My weight ballooned to almost 300 pounds, 278 pounds. My cognition kept declining. It got so bad to the point where if I went outside and someone asked me how old I was, I knew what year I was born, but I couldn't calculate my age. I couldn't have conversations. I couldn't participate in life. Um, so, do I think medications worked that great for me? I would say no, because my quality of life suffered so bad. I was unemployable. I had terrible anxiety, agoraphobia. Um, for about 10 years, I probably barely left the house. I lost touch with friends. I couldn't hold a job. I tried once early on in my diagnosis, but that brought symptoms of my illness to the point where I knew I couldn't work. So medications to me never gave me my life back. Um, in 2020, my health was further deteriorating. Um, I had a spinal cord injury. I was losing my ability to stand. I also couldn't apply pressure on my knee because a piece of my cartilage was loose in my joint and needed that removed. So I had two back-to-back surgeries, absolutely necessary, within a month at the very end of 2020. And at that point, I didn't know this, but I was also diagnosed, well, I was also suffering from a 4-inch incisional hernia from my 2004 C-section labor. And that, so my quality of life was really bad. I knew I needed to do something. I had previously tried Jenny Craig, lost 80 pounds, but I never felt well. I never felt mentally well. I still felt tired. I still didn't know what was wrong with me. I didn't know how to feel good because it had been so long. And so basically, I said to God, and I said to myself, I said, you know, if I make it through the surgery and I regain my ability to stand, which was not guaranteed, you know, because I was losing that. I didn't know if it might not get worse, but my leg was super heavy and hard to lift. And so I said, you know, to God, I was like, you know, I'm gonna really try. I'm gonna try to find solutions to my problems because right now they're just insurmountable. Like everything is wrong. Everything's inflamed. My intestines were inflamed. They thought I had Crohn's or celiac, you know. My thyroid back in 2006 when I was diagnosed with Graves, that was terribly inflamed. Everything was inflamed on me. So like I knew I needed to do something because at this point I felt like I was dying, probably because I was. You know, I could barely breathe. I I was sometimes defecating myself, and losing control of my bladder. You know, and I think that some of these things are like symptoms and side effects of the meds that you can be put on in the psychiatric treatment. And so like it it just got to the point I was like, this is not how I want to live my life. There must be a better way. And so I started researching and stuff and looking into anti-inflammatory diets. And so I started eating more whole foods and cutting out the processed stuff and the sugars and the carbs and stuff. So I went low carb, whole food, and I saw improvements. In May of 21, I started developing a drug-induced Parkinsonism tremor, and it was, I posted about this on X, where my hand was just twitching and stuff. So basically, in May of 21, I was dealing with symptoms of having too much antipsychotic in me. And because that's a side effect of my antipsychotic. And so I went from May to December, and I had meetings with my psychiatrist, and I met with the neurologist, and he confirmed, he's like, this is a side effect of your medication. Once you stop it, it will go away. And so I tried to approach my psychiatrist, and I said, you know, I'm also having problems swallowing. I'm showing signs of Parkinsonism, you know, and it's really affecting my quality of life. And she said, well, we previously tried to reduce your meds and your symptoms got worse. So like I don't feel comfortable taking you off your meds. And I said, uh, it's a valid concern, you know, and everything. But at this point, I felt miserable. It was no way to live. So what I learned is, so I started learning more and more. And so I looked at my geodone and I said, well, if I consume it with, um, at, not right with my meal, but, or take it with less food, you know, then it decreases its strength and potency by 50%. So I cut my treatment dosage in half. I was taking 60 milligrams. And so basically, I cut it down to like 30. And so, like, basically, I did that for a month. My symptoms stayed gone and controlled. And I just told my psychiatrist at the next appointment, I said, you know, let's just make this legit, you know, write me the script for this. And so she wrote me a prescription, and that started or deprescribing treatment. So I went from 60 milligrams all the way down to 20 milligrams, still not knowing why I was improving. I just thought maybe it's like something lifestyle that I was doing or eating or taking walks, like I didn't know what it was, maybe the anti-inflammatory diet. I had no idea that a diet could be such a potent intervention until I experienced it. And so I lowered my meds from 60 all the way down to 20. I could have been completely off of them. I was symptom free. And the only reason I stayed on them is because my psychiatrist says, well, we just don't like to see schizophrenics unmedicated. We, and so that begs the question, why is that? Why is that the gold standard of treatment? Because it it obviously was messing me up, and so I don't think that's really a great reason to keep someone on, especially when the side effects outweigh the benefits. But it is what it is. It's acceptable to let patients suffer and have poor quality of life. It's acceptable because there weren't any other treatments that you could do, but luckily now um, there are, and so like what happened after that. So I deprescribed in 22 all the way down to 20 milligrams, and in 23 I had some surgeries come up, the hysterectomy for the endometriosis, and and a couple of surgeries, and those are very stressful things your body goes through, and then then what happened was I was still eating low carb, low sugar, low fat, because I wasn't keto yet. I wasn't high fat keto yet. I was still eating low fat, and I lost all the weight. I lost half of me. And so like I lost like 136 or 37 pounds. And I ended up weighing like 136 or 137. I don't know. But like I lost half of me. And what I realized is that I was lean. I worked out all the time. I did all these interventions. I had incorporated intermittent fasting in 22, I believe it was. And so I was doing daily fasts and stuff, 16-8 plan. And I didn't realize what I was doing or why I was improving. And so what tripped me up was eating low fat. And so I didn't have the dietary fat that my brain needed, that my body needs, because your body needs that if you don't have it on you. And so like basically I relapsed, and I didn't know why I had improved, and I didn't know what I needed to do, but I knew it was something I did, because at this point I had never been able to come off my medicine for 13 years. So I knew something was taking place. So I went searching for answers. I asked psychiatrists, at the facilities that I was an outpatient and inpatient at, and nobody knows. Nobody knows if intermittent fasting could help you. Nobody knows. No, and that's the problem. We need more people to know this stuff does work. And so I went back home, from my outpatient treatment center program, and I looked at Metabolic Mind's YouTube channel. I stumbled on it, and I saw a video of Dr. Chris Palmer explaining his brain energy theory and ketosis and stuff like that. And I was like, I think we figured it out. And then I was like, I knew it was something I was doing. I was throwing my body into ketosis through more exercise, burning and utilizing my bodily fat and turning that into ketones that my brain was receiving. Because goodness knows, when you weigh as much as I did, I was steadily supplying my body and brain with ketones. So I was constantly in fat burning mode because I did 16/8 fast. And so then when I realized, I sought the help of a metabolic psychiatry dietitian. Denise Potter, shout out. uh, she helped me figure out how to incorporate more fat into my diet to continue to see the benefits that I had previously saw. So, uh, so unfortunately, though, at this point, they had tried medicating me back up. And so they medicated me all the way back up to the highest dose I've ever been on. Still no relief, no symptomatic relief. I was a mess. I was, my family likes to describe me as, the homeless people on the corner talking to themselves and just in a constant rant, and that they can't, they're stuck. They're stuck in turmoil and agony, and that's no place to live. But I was there. And so in 23, I took myself from what was absolute, absolutely psychotic and took myself to uh, a place of stability where I could taper. And this tapering experience has been a little bit harder. The diet really works. When my ketones are working great, like I've had high ketones to the point where I thought my meter was broken. At first it was a struggle. It was a struggle to get the ketones up to above 1. And then once I hit 1, it was like I started regularly hitting 2.0. And then it steadily got so good and I got better and better. And it just takes time to work out all the bugs and things that you could do wrong in the diet that affect your blood sugar, which will drop your ketones. If your blood sugar goes up, your ketones drop. So it took a long time for me to really realize how all the food I was eating was affecting my glucose. A CGM really helped me figure that out. Um, but I figured out those things, and so like my ketones even got as high as 8.0, where the keto mojo just reads high, and I was like, well, what does that mean? I've never seen that. And so like I was like, and the crazy thing is I've had people say, well, I want my ketones to be that high. I'm like, no, you don't. And I'll tell you why. Because when your ketones get that high, I feel physically sick to my stomach. My tummy hurts. It's not a comfortable experience. For me, it wasn't. Anyways, I can't speak for other people, but I can tell you what I experienced. And so when that happened, I told my dietitian, because I was still working with her at the time. I said, this happened. What do I do? And she said, drink a little, like I forget how much, like a teaspoon or a tablespoon or something like that of apple juice or juice. And I said, I don't know if I feel comfortable doing that. Like I am so reactive to carbs and sugars. I would be like the crazy lady again, talking, and just not making much sense. I was like, I don't know if that's a good idea. So like what I decided to do was just eat a few strawberries, because like maybe that would be what I needed to drop my ketones a little to feel comfortable, but still not overwhelm my system. And I think that worked really well for me actually when that happened. And so I got back on track. I was working the diet and it really worked. I had been deprescribing since spring of last year. And I started out at 80 milligrams and now I'm down to 42. The withdrawals are harder this time, super hard. I don't know why. Maybe it's because my insulin resistance is that much greater. Maybe it's because it's been a little longer that I've been on these meds. Both can contribute to this bad tapering withdrawal experience. For the tapering, I've been for the withdrawals, I've been getting like movement disorders, akathisia, and then I've also been getting a lot of neuro emotions and stuff like that, some sweating, some sleep disturbances, and stuff like that. And the crazy thing is, sometimes when I feel like I get my drug-induced tremor, the resting tremor in my thumb, where it just kind of pulses real bad. Usually that signals to me that I'm over medicated, but that's what it did the first time when I tapered. But this time it's a little different. I know I'm over medicated because why else would my body be experiencing too low of dopamine? I need to reduce my meds. But I'm in a quandary because this is the quandary that the withdrawals are so severe this time that I don't want to have intense neuro emotions that spike my stress hormones and my cortisol because I know what happens. That spikes my glucose. And when my glucose goes up, my ketones drop and can give me symptoms. And so this is why schizophrenia, withdrawing from your drugs, looks like schizophrenia returning, but it's a withdrawal symptom. And it's terrible because so many people are forced to go back up on meds or involuntarily medicated because it looks like the illness returning. And it is not. It is a biological process that happens because they've chemically altered your brain and your brain is adjusting, and it's frustrating because this is not a widespread treatment, and this isn't common knowledge to your psychiatrist or the treatment facilities. It should be because there's a growing community on X that talks about withdrawals and tapering, and they're very supportive and stuff like that. And my story is just one of many.
Yeah, I'm sure it is. And it's interesting that the first time you tapered, which was not with the help of anybody else, and you didn't know what was going on, went so well, but then going back on there, I mean, that could just be simply because you had to go back on at such a high dose that it messed with it. And that's really the unfortunate part too, is that we just throw these medications out there and we think the short-term benefit is better than the long-term consequence, and you're trying to get out of that right now with this tapering. And I know for sure because I've done it myself, tapering is not for the faint of heart. It's not an easy process.
Let me just tell you, neuroemotions caused me to throw a chair through through one of my bedroom doors because, like, seriously. But I'm I'm in control. What do you expect? You chemically numb someone from feeling and then expect them to behave normally? I'm acting like a 2-year-old because my brain is stuck trying to relearn how to 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 wire itself. It's I'm trying to I'm trying to be better. And it is frustrating because, like, when you're chemically numbed and you don't process feelings, you kind of forget how to do it. It's just like you have to relearn to live. I was so dysfunctional. Everything has been a learning experience. Everything. Driving again. engaging with friends. I mean, I've had to totally learn everything again, social norms, everything. And, this is stuff I once knew before I was medicated, but do I know them after medication? No, I'm learning them.
I can totally understand that and relate to that because this is the same thing. Like I feel like I finally was off all of my meds. I think by the time I was 41, 42 years old, but I was sick probably starting in high school. So when I have this great awakening, I really feel like I'm not in this 40-year-old body, but I have this mentality of a high schooler, middle schooler, high schooler. And it doesn't sound bad. You got to catch up, but you have to catch up surrounded by people your own age. You don't get to go through all the stages of high school and those kinds of friendships. Is that how you feel?
Yeah, I feel like once I got diagnosed, I stopped living. And it's been 17 years on meds. I'm still trying to come off them.
You're doing all the right things and you're taking your time just like you're supposed to. And there's nothing that you can do about this hold, this grasp that it has, except for be patient. That's the hardest thing. That's the hardest part because your brain is awake enough to know what's possible, but controlled enough to not be able to do anything about it and to have that little bit of a helpless feeling. You're doing all the right things and you're
Yeah, I
working with all
mean,
the right people finally.
I mean, withdrawals are tough. So, like when I go through them, I drop my carbs. Like I'll typically, if I'm eating 15 carbs and things are going fine, I drop them down to like 10 or lower than 10 because the I need help controlling my glucose. So my glucose spikes, my ketones drop during the withdrawals. So I know that works for me. I also drink tea with MCT oil to artificially jump my ketones because glucose and ketones have an inverse relationship. And so like you want your glucose low, your ketones high and stuff like that. But not too low. You don't want your glucose too low because that's dangerous. But that's not an issue for me because my meds make my glucose so freaking high that maybe, maybe to get through the withdrawals, I'm kind of wondering is like metformin going to be um like something that would ease it until I can get off the meds that are messing up my um diet from working as good as it could, because like they're raising my glucose and dropping my ketones, especially during withdrawals. And so maybe that would ease my withdrawals. So like I'm not opposed to exploring that. I know if I do that, I would have to make sure I don't go hypoglycemic and but I'm so far from hypoglycemic, it ain't even funny, because I've been on these meds for 17 years.
Yeah, so that's really interesting, and it may work. I know that they what are they using it for? I mean, I know it's a diabetes medication, but I think I feel like I read somewhere recently that they're using metformin for that very reason because it's dropping the glucose and symptoms of something else, but I can't remember what it is now. But that's okay. That's me having memory issues that we talked about before we got started. So that would be really interesting, and I think that would certainly be something to, if you did it, to work with somebody who could actually like write it down, take notes, and study to see if that is a viable treatment option because it could certainly help move that needle. No, that's like a conversation that doesn't happen very often is how much these medications affect your metabolism.
Oh,
It does happen,
yeah.
within our metabolic psychiatry space and who's learning from there, which is still, even though we are involved in it, it's still a small movement. It's growing, but that they know how much the meds affect the metabolism, but to just go out and see a psychiatrist that's not aware of this movement, they would not know to look for it or how to help that.
Well, a lot of psychiatrists will prescribe metformin with like clozapine or something like that. One of the ones that are more metabolically going to like jump your glucose and stuff like that and give you like all these horrible side effects, which so like a lot of everyday psychiatrists do prescribe that in conjunction with especially older antipsychotics and stuff like that, just because of the severe metabolic impact. But I my psychiatrist has never approached that to me, even though I was metabolically challenged and suffered. Like obviously, like my metabolic health was very compromised. She never approached that with me. I would probably have to approach that with her.
How is she about what you're doing? And does is Denise, as your dietitian, able to help with the conversation with your psychiatrist?
I stopped meeting with Denise last year,
Okay.
but my psychiatrist, she she when she when she saw me, because like when COVID hit, I just did phone non-video appointments. So she remembered me being my worst, you know, looking, and I just didn't look clear. I looked dazed. I looked drugged, and and that's what I looked like. I looked unwell and drugged and just in poor physical health. And she remembered me from those days. And then when I wanted to drop the meds, I decided I'm going to make an in-person appointment. And she said, you know, she didn't even recognize,
Hmm.
you know, and and stuff like that. And that was just at the very beginning of my journey. I still looked very much the same, but there was such a notable difference, even with just doing a minor drop of about 30 milligrams, that she was like, wow, you know, that you look, I didn't recognize you. And then she asked, what are you doing? So like she, she believes in the things I'm doing because she saw me drop safely after 13 years of not being able to. So she believes that I figured out stuff that can work for me. And so she's just like, what do you need the script to say? You
Oh, well,
know?
that's good, because that's a hard that even somebody that is just even just a little bit open is hard to find. So I'm glad that you have a person that is willing to let you kind of patient lead with some support instead of it coming from her. You're allowed to explore and to uh, investigate on your own what's working and what doesn't. So that'll be an interesting conversation to see if she wants to explore the statin or the metformin idea with you, uh, because it may just help mm, balance things a little bit while you're making up with diet.
That's
We
that's
want to believe that diet fixes absolutely everything, but when you have this kind of medication coming in that's got all this control, diet can only go so far. And I think that's probably what you're experiencing now.
yeah, I mean, I am I'm not I mean, there's a time and place for medicine, time and place, but prolonged use is absolutely going to hurt you in the long run. And I'm not wanting to be on metformin or my antipsychotic the rest of my life. My goal is to try to get off them as quickly and as safely as possible. And if one might give me a crutch to get off the medication that is troubling me and has been troubling me for 17 years, um, you know, maybe that is a consideration for an option. Do I want to stay on either one of those? No, I do not. I want to use my diet because I believe and know its power. and I know that it can help me. But during withdrawals, what the severity of my withdrawals, I would say, yeah, because like when my glucose is up, my ketones drop, I get symptoms. I get symptoms of my illness. I get symptoms of anxiety. I get symptoms of agitation and stuff like that. And the neuroemotions raise my glucose through elevations of my cortisol. And so like it's a tough predicament because the first time I dropped, I did 20 milligram drops in 22, and I safely tolerated those 20 milligram drops without any withdrawal effects. I was fine, you know. So I happen to think that it's either the duration was longer, the medication increased to a higher dose that my body just couldn't handle. Maybe the insulin resistance was more severe because of the medication. You know, I think it's those things. But yeah, the status quo is not leave me on meds that don't work. You know, that's and give me horrible side effects and compromise my physical and mental health. That is not the solution. So we got to get these drugs out of me. Like people ask me, well, what do you want to do? What do you want to, how much do you want to drop? I'm like, what's the point in taking meds that don't work? My diet works, but my meds complicate my diet from working, you know? So like it's a no-brainer. I don't want any meds.
Yeah, that's a fantastic goal. It's just taking a while to get there, unfortunately. But I think you're getting there. When you say that your symptoms come back, what type of symptoms and how do they compare in severity to when you were at your most sick before you started treatments with anything?
I would say that when when I get symptoms, I can be like a homeless woman, you know, just ranting and raving and just in severe states of distress and agitation and stuff like that. I would lack focus. I would lack clarity. My cognition would suffer. Um, you know, like I, I would say everything just becomes harder. Everything just becomes harder. Like reading a paragraph, like you're not thinking straight. You're just the symptoms. Like you could have you could have probably hallucinations, although I've only experienced hallucinations upon my initial diagnosis. Not really. Medication kind of controlled that. But I did experience one hallucination when I was withdrawing because I thought I could handle 20 milligram drops, and that gave me symptoms. So, and that gave me a hallucination. I was like, wait a second, we got to step back from this withdrawal process and maybe do things a little bit differently this time because my body's not responding the same way. Probably because the medication, like I said, was higher, the insulin resistance greater, you know, the duration of meds any longer. And so, like, you know, but I'm making adjustments. You know, I'm not going into this not thinking logically. So, like, you know, I would like to say that, you know, I'm in control. I'm in control. You know, this is not like, oh, look at her go off her meds. She's out of control. She's, you know, acting erratic. You know, yeah, if my glucose goes high, I will have some symptoms. But you know what I'm doing? What people see me do when I start feeling those symptoms come on? They'll see me reaching for like a meat stick or a fat bomb to lower my glucose because that's in control. That's the difference. That's the difference of being psychotic and and not being in not being that's the difference of being psychotic and can you hear me?
Yep, yeah, I gotcha.
that's the difference of being psychotic and not being in control and needing to be hospitalized or taking control of your illness. That's the difference of the ketogenic diet. That's how you can control your illness. You control it with food. You don't need the meds, and that's what I do. So, like when I feel that kind of coming on, I take control. But in the case where someone might not have insight and lacks awareness of this, you need a support person. You need somebody that can recognize that and say, well, let's try this and troubleshoot with you to work through it. In fact, I created a list on X. Maybe I'll share it with you, Robin. It's my ketosis checklist of things that I do to help me stay in ketosis. And so like when I'm having trouble, or maybe my glucose gets out of control with withdrawals, maybe I need to refer to that checklist or have my loved ones refer to it with me and go over it with me.
It
Because
sounds like
maybe,
you have a lot of control, even though you're having symptoms, they're not taking over your whole life. You're still having at least some clairvoyant time where you're like, okay, this is what's going on. Like, I get it, it's my meds. I need to change some things here and there. So do you get out of these moments fairly quickly?
oh yeah. So like basically I could feel like symptoms and agitation and just like I could feel like my mood or my anxiety. I could feel that shift coming, and I think everyone can. I think everyone can feel an impending like episode come on. And so like I think when you're really in tune with your body, which this diet helps you tune in to everything going on in your body, I think you can kind of stave off um, a downward spiral. And then if you're not able to do it, your loved one, if you're working with that checklist, like something like I did, to kind of help me prevent a downward spiral. I think you can work with friends and family to help keep you on the right track.
And I love that you said that that you include your family kind of on this. Like it's not something to do alone. I always say my family members often notice my symptoms before I do. Though it seems to me that you feel yours coming on a lot better than I feel mine coming on. But it's you need to create some sort of community around you, some sort of support around you in order to do these things. It's just like I said, it's not something to be taken lightly. You've got to have a team by your side. I would say, I guess if you had a pretty significant breakthrough event that happened as you were tapering, that your husband would come in and be like, here, eat this, it's going to make you feel better, and you need some fat, here, let me hand you this, and start force feeding, doing whatever he can, because I know he doesn't want to see these things happening to you as well. And it's just so easy. A lot of people hide, and this is not the time to hide. This is the time to circle the wagons and get the help that you need from outside sources as well.
Yeah, if I'm hungry, I bring new meaning to the term hangry. Like, hangry is like, oh, let's feed her. Because, like,
Well,
'cause food is my medicine.
yeah, yeah,
And if I
absolutely.
don't get it, I don't feel well.
Right. So does that mean, I know that fasting was part of your journey initially, and that's actually what made you realize that you needed to add more fat because you lost all of your body fat, and then you needed to add it into your diet. Do you still incorporate fasting now?
Oh, yeah. Yeah. My pin post, I think or my profile on X, I say I do intermittent fasting, daily exercise, and the diet, the ketogenic diet. And like I have to do fasting, but it's tricky. Like when you fast, you got to find out what works for you, because like what works for you might not work for someone else, or like it might not be a good option for you. Like I do the 16/8 plan because like I'm so sensitive as I'm going through these withdrawals and my food needs my meds need to be taken with food. And so like if I drop too many or milligrams of the geodone at a time, then I'm gonna send my body into withdrawal. So like I need to take that med with food. So I do a 16/8 fast, maybe 20-hour fast, but never longer than 24 because of that sensitivity. A lot of people have successes doing 5-day fast, couple day fast, but some people find that that stresses their body out too much, and it has an opposite effect on their ketosis. So like it really is something you're just gonna have to test your ketones and see what kind of fast works for you.
I really appreciate this individualized approach that you're talking about because it's very much individualized. So thank you for making sure everybody else hears that from you as well. They might not think people are tired of listening to me, I think. So I'm holding, and you can see behind me the Think Smart book, holding a little card. And you've talked about quite a few things that I thought maybe it would be interesting to go through it within the Think Smart framework because the Metabolic Mind Bazooki Group put this framework out as kind of like a workbook to help people focus on their goals while they go through their individualized process of healing and the tools that will work for them. So I wanted to kind of go through it with you a little bit because I know that you are also online with a profile that people can look at. What we've noticed is that it's hard to engage in conversations the way Metabolic Mind is set up. They provide information, but they don't really support right now talking to each other about it. And we want to get to that point. This is a group that I'm working with that we're trying to get that conversation going. So with that, I would like to ask you about these things, and then also in the context of your current tapering. So maybe some of the things that you said in your profile that's on the website might be different now because of the context of your tapering. So if you notice any of that, bring it up. So Think Smart it means therapeutic integration of nutritional ketosis, applying sleep, movement, avoidance of things, rebuilding yourself, and tracking. So we don't have to go line by line by each of those, but what is kind of your framework? You said you wrote down something on your X that you lean on, but then also does that apply in the same way?
Yeah, yeah. Like there's so many things I go over in my ketosis posts. Like I try to hit certain thresholds of macros like protein, carbs, and uh, 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 fat. Like I try to hit certain thresholds, like and that's all based upon my activity. If I'm less active, I can get away with less and stay in ketosis, a lot less. But if I'm more active, then I need more fuel. And so like that's a big thing for me. Sleep has been crucial and stuff like that. And I learned about the circadian rhythm and stuff like that because like when you learn how light can play a role in your circadian rhythm. Like, you get your morning first light of the morning, and then you get your afternoon light to help prevent the effects of the indoor lights at night and stuff, how that lessens them because indoor lights at night can affect your sleep hormone, your melatonin, which disrupts your sleep and stuff like that. But so like you're doing little things like that, and then getting more evening sunlight, that all helps me regulate my circadian rhythm. I don't think I really talked about it in the profile. You're trying to throw this together, you're on vacation, and so you're just like, oh, okay, maybe I should ask them if I can redo that so it'd be a little bit more helpful, but it is what it is.
I actually looked at it earlier, and you have two links that are included in yours, and both of them are about sleep. So I think maybe you did talk about it. But you know what? I'm the same way when they did mine. It was not a good time to be answering those questions. I probably should go back and do it again as well. But that's a good point. I mean, it evolves. These are great. It's like the structure, it's the framework, it's the skeleton of the things that you can do, and all of them can be expanded upon, and all of them can be tweaked a little bit of depending on where you are in time and space and what's going on in life. So that's a good point. Um, so you've just briefly brushed over activity, but before I ask you about activity, my other burning question, this is like the number one question somebody asks me if they're trying to implement, especially a therapeutic level of ketosis, and that is, how do you add fat without eating 5 sticks of butter a day? So do you have any tricks for how you add fat? I could probably eat 5 sticks of butter if somebody challenged me to do it. I probably could because I like
I,
butter, but not
I
everybody
definitely
can.
could. I definitely could, but I've heard people say, like, how do you eat that much fat? And that's a good question because, like, it is a good question, and it's something somebody that's just starting the diet is going to
Okay, so everybody, we lost Harmony for a second, but she's back now. So we're going to remind you that the question we were asking was about adding fat. What are some tricks that you have for adding fat?
so like I'll put like MCT oil in my tea, or make like a blended butter coffee. Those are super frothy and taste like Starbucks without the guilt or without the symptoms of your illness and stuff like that. Um, yeah, so, but I know you said something about eating sticks of butter. I don't mind sticks of butter. The only time that I do mind eating that much fat is when I feel like a little under the weather. Like we recently got carpet installed, and I felt like a little under the weather, and it was a little harder to digest all the fat, and stuff like that. So I just kind of didn't eat as much until I felt like I could tolerate it again. But maybe that's the thing. Maybe you gradually start adding more fat until you build up a tolerance.
Yeah, I think the people that don't like eating sticks and sticks of butter just haven't gotten there yet.
Yeah, yeah,
They'll be like us soon enough.
yeah. So like maybe make sauces that are very fatty. Maybe do some fatty sauces and dip your meats in, or like put some coconut oil in some yogurt, things like that, or MCT oil and peanut butter, and stuff like that. But those are some of the things I've done. As I'm tapering, though, I find that I don't do like a lot of yogurts, and I don't do peanut butter but initially when I first started, before I started tapering, I seemed to tolerate those much better. But now when I'm withdrawing, I think I have more control over my symptoms when I go more carnivore-ish.
Yeah, I was going to ask about that. Are you mostly in a like heavily meat based, or do you have vegetables? Do you do sweeteners, that kind of thing? Uh, what's kind of like your generalized overview of your diet?
Um, so I'm very uh I, I I try to stick more carnivore. Like I'll have a I'll have a burger with some cheese melted on it, and some fat bombs. I'll have a tea with MCT oil. Occasionally, I'll have some nuts, um, and stuff like that. And I have to be careful that I balance most of my things with enough fat, because otherwise it jumps my glucose and stuff like that. If I have like a high carb meal and I don't balance it with the fat, then I'm gonna have problems. And I think it's because of my level of insulin resistance from my meds, from taking them so long. I think I struggle harder than most people. And I think that limits my diet and my selections a lot more than most people, because I just don't have the tolerance and the leeway in my blood glucose that others have to still stay well and stay within therapeutic numbers. And therapeutic numbers look like 70 to 90 for your glucose. And for me, therapeutic numbers for my ketones, I feel best at least 2, but preferably 2.5.
That's pretty, yeah, that's pretty interesting, and that's also individualized. But the caveat of having the medication in there, that's making it so the diet can't do what the diet does. It does, I guess, make it a little more limiting, and perhaps over time, just like anything, that can evolve. If you get off all of those meds, then perhaps these other things can make their way back in after you've healed that. Uh, that would be a good goal too, so that you don't have to feel limited. Although I think it seems to me that you have your eyes on the prize, so it doesn't. I'm assuming it doesn't really feel limiting, because you know you're doing the right thing to help you taper.
Yeah, yeah. And I've had I, I know that when my ketones are high and my glucose is more stable, um, I can have a little bit more flexibility in my diet. And so I let my body tell me what to eat. And that's a very individual experience from day to day for me. And a lot of times, like if I exercise and fuel up properly enough, like maybe then I can have a little bit of flexibility, you know. But if I don't, then I'm not gonna have that flexibility, and that's okay, you know, like I have to eat to feel well.
Yeah, yeah, it's a whole different mindset around it. And my food is my healing. It's not some sort of fun thing to do. It's part of my treatment plan. So you've brought up exercise a couple times, and I did want to touch on that. I know that well, as you said, you were perhaps double the size that you are now, and you've lost half of your body weight, which is amazing, because I can't even imagine that kind of weight on you. So what does your workout regimen look like these days?
So basically, I prefer to do my exercise in the morning. That's my preference, but I don't like to do super like intense exercise first thing in the morning, because I typically don't respond that well to that, you know. Probably because what happens when you first wake up, like you get the dawn effect, you get the cortisol awakening response, and both those things will jump my glucose, and my glucose is already elevated due to long-term meds. So like that's not a good thing to do it right when I first wake up, unless I do zone 2, which is fat burning, like a casual walk or something like that. But if I want to do a more intense workout for the benefits of a different style of exercise, like maybe the stepper, which raises my heart rate, or go for a run, that might raise my heart rate, you know, and stuff like that, or do weight, depending on how intense, you know, that might raise my heart rate, or, you know, so like, or step ups or jump box or a rowing machine, or, you know, like those things might elevate my heart rate a little bit more. So like maybe that's not a, I just rolled out of bed and I'm going to go tackle the day kind of thing for me. But I like to do those things. My workouts typically are 2 to 4 hours long. This really helps me when I focus on moving that much in one setting. It really helps me, because what happens is I'm still on these meds. They decrease my motivation. They lower my dopamine. And so, like, if I can just make it to my workout, I know that the endorphins, the feel good hormones is going to push me through. So, like, but if I don't make it to my workout, and I'm on these meds, I'm going to sit my butt down on the couch and not move, because like that's what these meds do to you. They make you into like a zombie version of yourself. And so you know, like like I've done a post before. I'm like, sometimes it's better to just get down on the floor. You know why? Because you move more. These are like the little things, little tricks that you need to think about when you're on these dopamine lowering drugs. You need to think, well, how can I increase my movement? How can I increase my motivation? What stimulates dopamine to give me that motivation that I need to feel well, to use metabolic therapies, to help myself? And there's lots of things that stimulate dopamine, and you can you know you can change something up in your workout, and that stimulates dopamine. You can do something that pleases you or makes you happy. There's lots of things you can do to increase your dopamine.
That's a fantastic, a fantastic thing to say to everyone. I love that. Just the little tricks. What other little tricks do you think you have that you can share?
So I always do a daily update post, and so like one of the things is that I try to do in my daily activity post is variance. Like, I don't know if everyone reads my daily update post. It's more of accountability to me and to stay on track. But maybe some people do. But if you vary your workout, just like listen to music versus listen to a podcast and learn something versus changing up your routine, don't always doing the same stuff. But those little things help increase your dopamine and keep it at a good level to where you stay motivated. And so, like, I do those things because I'm on dopamine lowering drugs and I need that crunch
Yeah,
because
that
I'm not motivated at all. I get up, I don't want to work out. I want to sit my butt down. Like, I have no motivation. Yeah,
so
no,
it's
I
really
have
like
some. I
scheduled
have
time for you.
I have some. I have more since starting the diet, but I still struggle. I still struggle with motivation, but maybe that's just more of a normal human characteristic because like my motivation has increased considerably with the diet because like there was no way I could do 2 to 4 hour workouts when I first started. No way. So like I have to think that some of it is the diet helping.
Yeah, yeah, absolutely. That's a great question, and we've gone over our time, but I want to throw this out there. Maybe you have a minute to address it. It's that it's what kind of like what you just said is kind of knowing managing after you've been ill, because it's something that I deal with also after you've been ill, and then you're very into to your feelings, you're very into to your thoughts. So really like knowing the difference between what may be considered normal and what's your illness talking. And is this something that you think about all the time, or is it something that you're aware of that or it's in the back of your mind?
Um, I'm not sure if I understand the
So
question.
like earlier before we started recording, I was talking to you about grief, and I'm like, I think I'm acting normal in my state of grief. I don't think I've thrown myself into a depression. I just think it's grief. But just kind of questioning that, like I don't know all the times, and I'm very sensitive to it. So is that something that you're sensitive to as well? Just I'm just curious as a person that's gone through it myself. Um, if I have another person that understands.
Oh, I get you now. Like I get you now because yeah, I think a lot of times you are so used to being diagnosed that you pathologize your own normal sets of emotions and reactions. And maybe that's not your illness. Maybe that's just a little bit of, you know, normal human reaction or emotion and stuff like that. I think some of it is normal, but I do think that when it teeters to the point where you're like, maybe that's a little much, you know, then I think maybe you need to look at your CGM monitor.
Ah, very good. I've got them sitting right here next to me. I've been a little nervous to put them on. I have never actually used the CGM, so this will be part of my new phase in.
You've never used a
I've
CGM?
never used one, no, and I've
Oh,
never tested a ketone. I was very, perhaps it's because when, like you, when you did it the first time, I didn't know this stuff existed. I was just doing it for other reasons, and I had this benefit, and I've been able to manage without meds basically 7 years now. So, but I'm curious, and so here they are sitting next to me, but I might be a little bit of a baby about it. So I'll have to get through it, and I'll put them on.
I made myself bleed. Like when I don't know if I'm like hitting the wrong spot, just or maybe it's just because I'm lean and stuff. But I'm not too lean. I still have a little bit of body fat on me and stuff like that, you know. But I don't know. Like I made myself. I've been making myself bleed. I don't know. It's not that bad, really.
Yeah, you say how much you bled, and then say it's not that bad. I don't know if that's helping at all, but
Did
we'll
I
see.
mention I have to take iron pills?
Uh, yeah, I actually
Bad.
yeah. So that could be where the bleeding. That's the bleeding issue.
No,
it has
no,
nothing to
it
do with.
wasn't that much. It was like a minuscule drop. It was just a few drops.
You're gonna send me a picture, your whole arm is gonna be bloody. It's gonna be a thing, and I'm going to do it. I've told people that I'm going to do it, and sitting here, I just haven't done it. I'm a baby. I'm a big baby. I'll admit that right right now. But I'll keep you posted on it because it is going to be interesting. I've never done it before, so it is going to be interesting to see what my intuitive eating is doing, and
I
maybe I
would be,
don't want to find out.
I would be curious to see what level of ketones you feel well at after doing this for 7 years, you say?
Mhm.
Yeah,
Yeah,
I would
eight
be
years actually.
curious
Yeah.
because uh what is his name? Is it Roger? Is that his name? The optometrist.
Oh, Eric. Yeah, Dr.
Eric.
Eric.
Yeah,
Mhm.
totally off. But that's okay.
That's his
Yeah,
last
because
name.
I think that he mentioned that he felt fine with under 1.0 ketones, like and you know he's been doing this a long time, you know, and so like maybe there's a certain level of healing where you don't need the super high ketones to feel well, you know. Maybe there's a certain level of healing that takes place. I know my dietitian talked about her treatment with people with epilepsy. Sometimes they can completely come off the diet, but you know, sometimes they can't, you know, and so like maybe there's a degree of healing that you probably won't need as many ketones as say I do.
Yeah, that's a good point. I do know people within the depression and bipolar space who have been able to back off of the diet and remain in remission. So that is interesting. And then I mean it's a completely different set of neurological issues that are happening, and our medications were different, and so that does. Some people can get away with very light ketosis, and some people need to be super deep into it. And again, it's all individualized, which is really the point that you've made this entire time. Well, Harmony, I'm sure we could talk forever and ever and ever. And I just looked forward to this so much. I'm so glad we were able to make this happen. But time has run out. You've mentioned that you're on social media. I will put your social media uh, on on the show notes. But before we go, I try to ask a final question, and that is just like what would you be your biggest piece of advice to get someone started on their own, their telling their own story?
tell them their own story.
Yeah, what would there be the thing that they would do to get themselves started? Your
Um,
biggest piece of advice.
to sharing their story. Um, you know, maybe just start noticing things and getting curious and start, um, finding out like what works for you and what doesn't work for you, because this is an individualized response. And like if you want to share it, I think that's a great idea. I personally started sharing my experience navigating my mental health because like I realized there wasn't um, as many resources as I needed, and I didn't get the help from my psychiatrist. Actually, George Ede actually spoke to my psychiatrist, and is helping her deprescribe me because my withdrawals were so hard. But I would say, find community, find people that support you, and start talking about your journey because your experience is very individual. And, it's going to be different for everyone because there are different causes of psychosis in everyone.
I love that answer. I always like asking that question because the answer is always different. And to leave it specifically on getting started to share your story, I mean, without us sharing our story, that's why this podcast was created. Without us sharing our story, we can't get that message out there, and we can't help somebody else. And it's just important to do. If so, I really appreciate it. I know you don't do a lot of interviews, so I really appreciate that you took the time out to talk with me today, and um, very important conversation about um, reducing medications. I'm so thankful that you talk about it and you talk about it openly, and you talk about the struggles that come with that process, so that uh, you know because people get into tapering, they want to do it right away, and it's not always the best choice for sure. So I just really appreciate you being real frank with that conversation.
Thanks, Robin. I really enjoyed chatting with you too. Uh, you're doing great work with your um, advocacy.
Oh, well, thank you so much. And thank you for joining us on Keto Biography.
Thanks.
Bye.
Bye.